It's like I should have had some emotions. I think if I'd had emotions, I would have done something and might have been able to stop all of this. And so, once again, it's far better to get things that are going to have benefits without the side effects. But notice this is one of the things that can benefit. If you have high cholesterol, and we measure everyone's cholesterol that comes through the program, but if you have high cholesterol and you get it lowered, it's going to improve depression and mood and improve the impulsivity. And it won't cause a numbness to emotions per se. So let's take a look at cholesterol in foods. Fruits, grains, nuts, vegetables, and plant foods do not have cholesterol. Non-fat skim milk has 4 milligrams, 2% milk 18, whole milk 33 milligrams. Egg white is an exception to the animal product rule, no cholesterol. Mayonnaise 8 milligrams, ice cream 29, butter 31. The egg, that's 213 milligrams of cholesterol. Egg yolks are very loaded with cholesterol. A lot of people think tuna is part of the plant kingdom and has no cholesterol, but tuna is actually part of the animal kingdom. It has a liver, and it does have cholesterol, and if you feed fish to a plant-based vegetarian, their cholesterols invariably go up. Clams 57, crab 64. A lot of people think if I just scrape the fat and the skin off the chicken, it'll be no cholesterol chicken. But even if you scrape the fat and the skin off, it's 73 milligrams. Pork is 76, beef 80, but if you don't scrape the fat and the skin off, 82 milligrams. Chicken actually has higher cholesterol than red meat. A lot of people are not aware of that. And a lot of people think seafood is where the advantages are. In fact, in Oklahoma, hopefully not so much in Oregon, but in Oklahoma, we ran into a lot of people that told me they were on a seafood diet. And of course, I would ask them what that meant, and they said, well, when I see food, I eat it. And I never responded back with some of the thoughts that went through my head, but often I thought, you didn't need to tell me that. I could tell just by looking. But sardines, 120 milligrams of cholesterol, even higher yet. Shrimp, that's 165 milligrams. Kidney, 329. So the organ meats are loaded. Liver, that's 410 milligrams. Caviar, 500 milligrams. And if you see anyone feasting on beef brains, you have to wonder about their intentions. 1 3-ounce serving, 1,697 milligrams of cholesterol. Now, we also know that cholesterol, although it raises blood cholesterol, cholesterol in the diet can have even more damage than just the raising of the blood cholesterol. In fact, earlier, Jeremiah Stamler indicated that dietary cholesterol is an independent risk factor no matter what your cholesterol is for the development of atherosclerosis. So high cholesterol is an independent risk factor as well, but if your liver doesn't make as much, a lot of people think they can get by with eating all these cholesterol foods, but it actually is an independent risk factor. And Dr. Bruce Taylor was the one who discovered, actually it's kind of interesting how he discovered this. This is due to having medical students. Medical students came to him and said, we need to do a study before they'll let us graduate from medical school. A lot of medical schools, you have to do a study. It doesn't need to be publishable, but at least it has to do a study so they can understand how it's done and the statistics and all of that. And so this group of medical students, 4 of them were allowed to work together on a study, and they said, you know, it has to be something that hasn't been done before. And so we've looked at the medical literature, and no one has ever fed pure cholesterol to rabbits and monkeys. We'd like to feed pure cholesterol to rabbits and monkeys and see what happens to them. And Dr. Taylor says, well, why are you coming to me for that? And they said, well, because you're the cholesterol researcher, and we thought you might have some. Do you have any? And he says, yeah, I've got lots of cholesterol. It's pure cholesterol. It's been there for a while, but you go ahead and use it. And so they fed pure cholesterol to rabbits and monkeys, and within a few weeks, those rabbits and monkeys started to have strokes, heart attacks, all sorts of vascular problems. And they wrote up their study and their data, and they put it all together, and they were through. But Bruce Taylor, when he looked at that data, he thought, cholesterol is bad, but it shouldn't have been that bad. Just a few weeks, heart attacks and strokes in these poor rabbits and monkeys. And then he began to think of the cholesterol he had given them. The cholesterol had been exposed to the air because the lid had been off. It had become discolored. When cholesterol is oxidized, it actually starts to turn a darker color instead of a clear, waxy substance. And he thought, I wonder what would happen if we fed pure cholesterol that's never been exposed to the air to rabbits and monkeys. And so medical students were gone, but he now did that study. And he found out pure cholesterol that's never been exposed to the air, it's non-oxidized, has no damage to the blood vessels. Weeks later, blood vessels were clean. And then he thought, okay, people don't eat just pure cholesterol, they're eating foods. So let's take a look at the foods that are the most damaging. So he would feed just this food for a day to a monkey, and then he would go in 24 hours later and count the dead cells in their aorta. And he found out the most damaging cholesterol, the ones that are the most oxidized and produce the most damage. Number one damaging cholesterol he found were custards. Now, what are custards? Milk, eggs, and sugar. So you're mixing up eggs, this high cholesterol food, in a sugar environment, and you're heavily oxidizing it. What's the most commonly consumed custard in America? Good old-fashioned ice cream. And this is why one of our board members at Weimar has come out with 32 flavors, one more than Baskin-Robbins, of ice cream. And his ice cream on the street gets rated higher than regular ice cream. People will prefer it. A lot more people prefer his ice cream than the regular ice cream. And he was frustrated because it didn't have any milk in it, didn't have any eggs, no animal products, but yet very creamy. He made it, the base of all 32 flavors is oats. By smashing the oats, you can make them very creamy, and no cholesterol and no oxidized cholesterol. He was frustrated because in America you can't call it ice cream unless it comes from cow's milk. And even if it comes from goat's milk, you can't call it ice cream because of these trademarks. And so he finally found the name. It's called We Can't Say It's Ice Cream. And they did allow him to call it that, and a nice substitute. Second most damaging, pancake mix. This was Aunt Jemima's pancakes he was looking at. Pancakes what are they made out of primarily? Yeah, you're powdering up eggs and flour together, and the powdering up of the eggs heavily oxidizes it. And this is one of the reasons my wife designed a book. You'll see why here in a little bit, but breakfast, as you'll find out, is the most important meal of the day for mental health. And a lot of people don't know how to cook breakfast tastefully and healthfully and adequate with the tryptophan and the tyrosine and all of those things. So she wrote a cookbook called Brighten Up Breakfast, and it has 4 different types of recipes there. They're all great pancakes and no oxidized cholesterol in it, and plenty of the good nutrients. Third most damaging was Parmesan cheese, and that was tied with lard. That's not a misprint. Both of them were tied with the third most damaging. And Parmesan cheese, again, you're powdering up the cheese and heavily oxidizing it. But this study also explained something earlier of a study that had been done in Louisiana that we didn't quite figure out until Dr. Taylor's work. Is Louisiana known for its healthy food? No. Louisiana is known to have possibly the most unhealthy food of all 50 states. The Cajun food is very unhealthy, lots of fast food restaurants there. And the mothers in Louisiana, the way they eat, they actually have higher cholesterol in their human breast milk than cow's milk. At least the typical mother there in Louisiana. And so they did a study because they thought it would come out differently, but they took a look at infants consuming cow's milk versus human breast milk. And it's a little bit morbid on how they did this study because they did it when infants died of unrelated causes to disease. In other words, if they got into an auto accident and died, if they got into sudden infant death syndrome and died, or something like that. And so their arteries were looked into based on their diet. And one group had clean arteries, and another group of infants actually began to have the fatty streaks of atherosclerosis, already damaged to their arteries in infancy. Which group do you think had more of the damage? Those consuming human breast milk or those consuming cow's milk? Well, if human breast milk is higher in cholesterol, you might think it was human breast milk. But actually, those consuming human breast milk, even though their cholesterol level was high from unhealthy mothers, clean vessels. Those consuming cow's milk actually had the fatty streaks of atherosclerosis. What was the difference? The difference is the way the infants drink human breast milk, it's directly from the nipple, it's not exposed to the air, and it's not oxidized. And so that's why those vessels were clean. So the best way for you to drink your cow's milk? Go down to the barn and get it straight. Interestingly, we were told years ago, especially harmful are the custards and puddings in which milk, eggs, and sugar are the chief ingredients. Free use of milk and sugar together should be avoided. And then antioxidants are also healthy for the brain. It was observed that patients with generalized anxiety disorder and depression had significantly lower blood levels of antioxidants in comparison to healthy controls. After dietary supplementation of these vitamins for a period of 6 weeks, a significant reduction in anxiety and depression scores of patients were observed. What are the antioxidant vitamins? Anyone want to name them? C is an antioxidant vitamin. E is an antioxidant vitamin. A is another antioxidant vitamin, the A, C, and E. And being on antioxidant vitamins can be helpful, but the power of whole plant foods exceeds that of their component parts. In other words, 1 cup of kale has 50 milligrams of vitamin C and 13 units of vitamin E. But the antioxidant potential of 1 cup of kale is equal to 800 milligrams of vitamin C and 1,100 units of vitamin E. That means it's a lot better to eat your kale than it is to take A, C, and E from vitamin pills or vitamin pill areas. And so the Human Nutrition Laboratory in Baltimore, Maryland recently came out with the top 10 antioxidant vegetables. These are the ones that have the most potent antioxidants in the foods themselves. Number 10, eggplant. Number 9, corn. Number 8, onion. Number 7, red bell peppers. Number 6, beets. Beets are showing up in a whole lot of studies as being very healthy, partly due to its very high antioxidant potential. Number 5, broccoli. Broccoli has some additional advantages of the cruciferous vegetables, very high in antioxidants. Number 4, Brussels sprouts. And if you don't like Brussels sprouts, you have to come to Weimar Institute, because the way they make Brussels sprouts at Weimar, we haven't found a single individual that does not like them. Number 3, what is that? Spinach. Number 2, what is that? Kale is number 2. Anyone want to guess what the number 1 antioxidant vegetable is? Number 1 is garlic. And this is the advantage of being married to a Romanian like I am. Every entree starts out with 4 cloves of garlic, it seems. Garlic has a lot of other beneficial properties as well. The top 10 antioxidant fruits. Grapefruit is number 10. Kiwi is number 9. Number 8, cherries. Number 6, red grapes, the bioflavonoids, resveratrol, a lot of those, even some anthocyanins in red grapes. Oranges are actually up there in the, I think that's number 6. Number 5, plums. Plums are a humble fruit, but they're loaded with antioxidants. Number 4 are raspberries. Number 3, strawberries. Number 2, blackberries. You have a lot of blackberries in Oregon, don't you? Yep. I think they even grow wild up here a lot, don't they? Yeah, those wild blackberries. And the number 1 antioxidant fruit, blueberries, number 1. And we talked about those anthocyanins yesterday in regards to memory. And so these are very important. And notice the top 4 are actually berries. The berries are quite loaded in the antioxidants. And then randomized controlled trials have shown a plant-based diet associated with healthy mood states will be able to lower the depression scores by 50% in a typical person just by getting arachidonic acid out of the diet. Arachidonic acid is a pro-inflammatory mediator that's present in meat, fish, and eggs. It's not present in milk or plant foods, and of course the plant foods are going to have higher antioxidants and higher amounts of tryptophan tyrosine to get across, so significant advantages. Males and females drop by 50% alone. Why were vegetarians significantly less depressed, anxious, and stressed, and even healthy meat eaters in the study? Negligible arachidonic acid intake may explain the favorable mood profile we observed with vegetarian diets. And then there may be some things such as herbal preparations that we might utilize to help people in some specific ways. Does anyone recognize this flower? It's not passion flower, but a good guess. There's something in this flower that has been shown to be highly effective in treating depression and anxiety. And it's the red stems there. Saffron, that's right, saffron. 30 milligrams daily of saffron is equivalent to Prozac daily in 6 weeks in improving depression scales, but no sexual side effects with the saffron, unlike the Prozac. It also has been shown to improve premenstrual syndrome, and even smelling it has been shown to be helpful. It also worked as well as the leading drug in treating Alzheimer's without the side effects. And so saffron is very helpful in treating dementia and arresting the progression of it. It seems to inhibit the amyloid beta protein development. And then there's another preparation that we've utilized extensively and have shown some significant benefit called Selexon. Selexon, placed in capsules, has been utilized for generalized anxiety disorder, and 80 milligrams daily has been shown to be beneficial. Relief of generalized anxiety disorder in 76%, with over double improvement compared with placebo. And it also improves sleep quality, even though it's not a sedative, because it's getting rid of the anxiety and no frontal lobe suppression. 6-week trial and improved anxiolytic effect was comparable to the improvement noticed with lorazepam. Now, lorazepam is one of those benzos that's used for anxiety, but it's a frontal lobe suppressant. You develop tolerance. It's highly addictive. But the Selexon, also called Lavella, it comes in a preparation that's purified. Actually, the Lavella gives you an idea where it comes from. Anyone want to guess where it comes from? Lavender, that's right. The lavender oil is purified into Selexon. And since lavender oil showed no sedative effects in our study, has no potential for drug abuse, Selexon appears to be an effective and well-tolerated alternative to benzos for the amelioration of generalized anxiety. And for those that are on benzos, we'll actually give them some Lavella to be able to help get them on a weaning program and be able to start getting off. The other thing they've noticed with Lavella, we've used it for test anxiety. You know, there are people that have anxiety, particularly when it comes to test time. And so they've used lorazepam for that too. And lorazepam has been shown to help get rid of test anxiety, but it worsens your test scores. Why does it do that? because it's a frontal lobe suppressant. Lavella gets rid of the anxiety, but it does not suppress the frontal lobe, so the test scores actually go up. So those who do poorly due to test anxiety, they'll actually do far better by taking Lavella prior to the test, which is a kind of a nice feature for those at Weimar who may be struggling for something like that. Common mediator that affects of B12 and folate deficiency is reduced SAM-E. This is a table. As you notice, methylation. If someone is an undermethylator, they're going to have problems in that methyl donation of making those three neurotransmitters. That's dopamine, 5-hydroxytryptophan, which is serotonin, and norepinephrine. We need to add a methyl group to all of those. And for someone who's an undermethylator, if their homocysteines are not too high, this is why we have to measure all of these things in the bloodstream when people come to us. We're going to be measuring all of these different biochemicals. If the homocysteine is not backed up and too high, what will be helpful, and often far more helpful than any SSRIs or any of those SNRIs, is actually to give them S-adenosylmethionine itself in a supplement. It's something that is found in nature, but we can give it in a supplement, and SAM-E will build up over time and will be far more effective without worsening the impulsivity, and will help a lot with this anxiety and those sorts of things. So this is why it's good for us to know what's going on in the brain. There are individuals who are actually overmethylators. Overmethylators have a far different personality. They're individuals who are, they're not social phobes. They're very socialites. They tend to be very empathetic by nature because they already have enough serotonin activity. They tend to also be creative. They're more artistic, but they're not so competitive. They don't have to get an A. They don't have to win the game, that sort of thing. And overmethylators can also suffer from depression and anxiety. They can also almost become histrionic at times under stress. And these individuals will actually respond to folate. Folate actually clears up those channels in their reuptake promoters, so we might actually give them folate supplements. Everyone needs folate. You need folate even to methylate adequately, but if you get even an abundance of folate, it will actually help in regards to overmethylation. So those are things, again, that we would look at. Excess calories can reduce synaptic plasticity and increase the vulnerability of cells to damage by causing free radical formation that surpasses the buffering capacity of the cell. Moderate caloric restriction should thus protect the brain by reducing oxidative damage to cellular proteins, lipids, and nucleic acids. Many of the beneficial effects of caloric restriction and fasting appear to be mediated by the nervous system. Intermittent fasting results in increased production of BDNF, which increases the resistance of neurons in the brain to dysfunction and degeneration. And if you fast for over 12 hours, no caloric intake, metabolism of fat stores release fatty acids called what? Ketones to be produced, which improve memory, learning, and reduce neurodegeneration. This is the advantage of ketosis. And if you go 17 hours, you'll even produce a lot more. And so for a lot of people, if they're able to do this, one of the most brain-preserving diets you can be on is one where you're fasting every day. You eat a good breakfast and you eat a good lunch, but you don't eat a supper. It's called time-restricted feeding. It's been well studied now in the scientific literature, and it's an easy way to maintain your weight without getting obese. And it also actually helps turn on the positive neuroplasticity switches. The world doesn't seem to know how to get you to ketosis unless they take you off carbs. So this is why the paleo diet has some attraction, because people are trying to get ketosis, but the paleo diet, you're going to have arachidonic acid, you're not going to have as much antioxidants, you're not going to get enough tryptophan and tyrosine into the bloodstream. But this is a win-win, because if you're on a plant-based diet with those healthy things, breakfast and lunch, and then do a fast in the evening, what a difference it can make as far as your brain biochemistry. So once again, BDNF goes up as little as 12-hour fast, goes up even more at 17 hours. BDNF is kind of a brain fertilizer that helps us. And then the advantages to eating breakfast. A lot of people, if they skip a meal, they're doing a 17-hour fast and they're starting to eat at 1 in the afternoon or something. That's an issue because Studies have shown the meal to skip is supper, not breakfast. Breakfast, you'll have better cognitive performance, better scholastic scores, improved creativity, and you have more depression when you skip breakfast. And breakfast eaters perform better on tests, spatial orientation tests, and cognitive tests, and are calmer at the end of testing. I'll close. I think this is my second to the last slide. This is a prestigious journal in Europe called Lancet Psychiatry. And notice the quotes from this journal that reviewed nutrition and mental health. Now is the time for the recognition of the importance of what? Nutrition and what else? Nutrient supplementation in psychiatry. Nutritional medicine should now be considered as a what? Mainstream element of psychiatric practice. So if your psychiatrist is not talking nutrition or potential supplementation, they are no longer mainstream. They are out of line of the scientific data that has been accumulated. And these are things that can produce powerful effects and ones that can really produce freedom. I'll close with the French philosopher Denis Diderot. He said back in the 19th century, doctors are always working to preserve our health and cooks to destroy it, but the latter are often the more successful. It doesn't have to be that way if we retrain the cooks. If we retrain the cooks to have healthy food and tasty food, there's no reason to go back to the other way of doing things. And that's why I would also encourage you to look at the great cookbook that's out there so that we can have healthy food that is tasty.